that's great. So checking it's all right. Mommy's there. So, or mommies and borrow loans. And then gentle inversion. It's all right. Looking for postural changes. Look at that beautiful AT&R. Look at that. You see that, guys? Yep. Okay, and then she goes the other way. Look at that beautiful. Isn't that perfect? Look at that well-adjusted brain. Good job. I take a little pressure off of her. I'm going to just do this for just a second. See how I use my whole body to make her feel comfortable? It's okay. Go back to mom for a second and explain. When I invert her, you don't release her leg, but you release a little pressure. Does that make sense? You're essentially holding her more on one side. So like this. What that does, this is reverse fencers. And what that does is it stimulates that rotation. So you're looking, she did it perfectly, just fine. That was great. But it helps us to assess her rotation that her reflex will make us have. So make her have and do. So you can do that. After she starts walking, this is no longer valid because she's weight bearing. Okay? Plus they're heavy. Okay? So then essentially, I need to just sit up, sorry.
That's the same as when you
I got you. Sorry.
That's the same as when you
Same as when you bend. I just don't like to bend the leg because in all honesty, I'm not going to mess with the lower extremity all the way to the pelvis. Does that make sense? I just like to kind of release the pressure. But you always keep a finger on the top so they don't slip through. Because if they're agitated, they can wiggle because they've got those, and even if they're not, they've got their, curvature reflexes, right? So that's a big deal.
And it should rotate to what side?
The ipsilateral side.
Yeah.
Fencer, right? Just like a fencer. Yep, exactly.
Is that?
The only reason it's called reverse fencer is because you're inverting them.
Okay.
What?
Is that compression on the foot? Twisting? I mean, what were you actually doing when you twisted the foot? How was you compressing?
No, just holding her by her foot and her ankle. Is that your question?
Yeah.
And then when I'm saying I'm releasing. I'm holding equally both pressure, like kind of see your arms. Pull back from me. Not pulling, but I have equal tension on both arms. And then when I release, I'm still holding on to him, but I'm pulling most on that side. Does that make sense? I'm releasing the tension on that side, so it stimulates her reflex to go that side or the other. Does that make sense? Yeah. I mean, I was taught, just release the arm, the leg, and the parents go, oh my gosh, what are you doing to my child? I use my full body to make sure the babies are comfortable. So when I play with babies, I won't go through all her reflexes because we went through that, but I like to test her joints and see her tickles and see how things are going. You're so rock star right now. Yeah, you are. Look at you, big girl. You should do that. That's perfect. Kind of going through here. This should be tickly. She's integrating though already, which is great. Give me that. Look at that beautiful flexibility. That's wonderful. Look at her creases. She's got perfect creases, Mommy. Look at this. But interestingly enough, look here. Now this is not, she doesn't have this, but in hip dysplasia, if you guys can see her cute little folds, 1, 2, 3 bumps. See 1, not 2, 3. See that? She doesn't have a symmetrical fold here. So I assess, usually, and she actually does if you kind of move her skin. See how she's got pudgy in there? This way. She breastfed? Yes. Good job. But breastfed babies have lots of nice, healthy pudgy. Is that tickly? Is it tickly? Look at this dimple. Yeah, it's fun. So I tell people this, I can't believe I get to be paid for playing with kids because it's super fun. But while they're calm and you're hanging out with them, you're developing a rapport and you're checking them and you just kind of see how things are going, check their jaw, check their nose. I do a cranial assessment too, which is without the scope of this talk, but I check them. At least they're fun to know. Oh, good. Look at that strong. Tell me you're getting ready. You're getting ready, double dimples. Look at that. Oh yeah. What's up? Right. So cute. So then all that sort of thing. You're assessing her general tone, all this sort of thing. You are just a button. All right. You turn over, and then you can do this on mom on the table. This is cold, so it wasn't too cold. But anyway, maybe it's she'll let me do this. She's used to being adjusted. So there you go. I always undress the baby and I assess the gluteal cleft. So if you guys can look a little closer. So I put this down. Now ideally, because of the rotation, you want her looking straight ahead. So if someone gets her attention there, and then you can assess. Now there's gluteal cleft and then there's gluteal folds up in through here. Essentially, she's pretty good. And she's got a lot of tissue. So sometimes it's hard to assess there too. And the second assessment thinks she's good. The second assessment is palpation. Okay, she's a little restricted on her left sacrum. So I'm going to adjust that there when I go into the adjustment time. So I kind of tell her, this is what I'm going to do. Here's what I found as I'm going up into that mid-thoracic. She has any problems with reflux or anything like that?
She does.
I can feel it right here. Yeah, check across it. Okay. And if you have a question, I can tell you. Okay, perfect. But you carry her, so that's even better. Hi, so cute. What are you doing back there touching on me, huh? What are you doing, she says. Let's see how you turn. I have a pillow, a cervical pillow, that I use for my babies at the office, so I can just do this very easily and have fun, right? So this turn, and they grab your hands and they go, ooh, I like it. Turn, turn, turn. You can elicit a little of that rooting reflex. She doesn't have it anymore because she's outgrown it after 3 months. Yeah, boy, true. I can look at her mouth and see what her teeth are doing. I can see her little lip and any kind of tongue. Right? No, she can nurse no problem. Yeah, great. And then to the right, I can check her range of motion to see if it's ratchety. And if she doesn't like it, or just have a preference for one breast or another.
She has moments that seems like I can tell if she's not wanting to lap on the one side that she's having issues with.
Here's a good clinical question. Which breast produces more milk?
Right.
Okay, so why is that? The breast produces on demand. So which side, if her right breast is producing more, which side can the baby rotate to easier?
Is there just in general the right side produces?
That's not true.
It's not true.
That's not true. It's demand. Hey, look, we're nursing baby. On the right side, she turns to her right. Okay? Hey, see, and then they play and they all this. Okay, so she can turn her head to the right more. Going to the left is a little bit more difficult. It may not be overt, but it may be something you palpate and it's something that's in the history. Then I have mom come over here and I just kind of hold baby. And I just say, okay, hello. And she goes, this is a perfect example. She's getting ready to push. She's almost ready. You can tell. This core development has to happen before we do any sort of crawling. That's big. So even though, she's having difficulty turning to her left, she does have what I'm doing right now with subluxation. See, actually it's a C2. I know, I found it. I'll fix it. I start from bottom up though and use the base, or the cervical system, okay? So I'm going to lay on your tummy. Let's do some tummy time. And tummy down like this. Alright. And then I have, yeah, exactly. So baby's not turning around, but mom's just watching, keeping her spine straight, because we know what mirror image postures are, right? So we don't want to do something that's not there. So left sacrum, just a little adjustment. Good job. And I always do this, not because it hurts, but because it distracts. Right? It doesn't hurt, she's fine. But it distracts, and I go, oh, tell us good job you did right there. And you go, okay, whatever. You know? And it helps them stay tense. Now, a baby's whole job is to lift their head and lift their trunk. So when you put them down, you either have to have a face cradle so they don't squish their head, or you have to turn them to rotation. What rotation does she need to be turned into? Okay. Mommy gets to just hold. I know. Good girl. Oh, that was a tough one. Give mommy back. Just for a second, right? But just see, right? This is awesome. Alright, so you're good. So we're gonna do some left rotation.